Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order, and that will going to help you for the continuous study. I hope you will make use of it. So in the last class, we were discussing about the functional integrity of each body parts. That means, and we are trying to say, among the growth and development is very important. Among the structure and function, although both are important, function is more important. And among the properties, more than the physical properties, it is the psychological properties and emotional properties, etc. So that is very important. So that determines the level of the health. So today we shall have another important aspect related to the holistic approach. So that is the big question, whether the medical science or medicine is a science or art. Now this is a big question. Always there is a debate on the topic whether medicine is a science or medicine is a art. Okay, so since so many years this debate is on, now debate is further continued. Which one is more dominant? Whether you say medicine is a science, that is a dominant statement, or whether medicine is an art, that is a dominant statement. That means which is more true. To be frank, both are true, but there should be a harmony between these two. That means when you are practicing a medicine, there should be also intermixing of the art. So without the art, so medicine cannot be more effective. So that is the final statement. But how? The reason is, what is science? So let us discuss one by one. What is science? Now basically science actually relates the study of physical world with the natural laws, isn't it? That is science. It relates the study of the physical world, external world, and correlation between the natural laws, how it is governing, how it is possible, whether it is physiological, whether it is pathological, like this. But in medicine there is no such natural laws whatsoever. Okay, in the science, what we say, science, see, definition of science, it is the study of the physical world and the natural laws. But when you go to the medicine to say that this is a science, there is no such natural laws in the medicine. Because medicine is always variable. So you cannot have a interrelation between that. Or I cannot establish an interrelation between these two. Okay? Because medicine is variable. One medicine will going to work on my body in a different way and in another's body in a different way. That is what is exactly told in Ayurveda. So medicine is not uniform to all. Should be administered. Medicine should be administered Purusham Viksha. Okay? A single medicine will going to act in a different way in different person. Although in the present contemporary science we say that yes, these are the generalized actions of this particular medicine, but there is no guarantee that that same medicine will going to act in the same way in each and every patient. Okay, so this was told 120 years back by William Osler. He told that medicine is a science of uncertainty and it is the art of probability. Medicine is a science of uncertainty and also it is a science of probability. So this is actually what Ayurveda is also telling, Purusham Viksha. So you have to administer the medicine by looking into the Desha, Vaya, Kala, Agni, Koshta, etc. Because I cannot predict that one medicine will going to act in the same way in a person of different constitution. Ayurveda also believe in different constitutions like Vata, Pitta, Kapha. Therefore the concept of individualized or personalized medicine is developing. So Ayurveda has to give more on that. Ayurveda can contribute a lot for that particular part, individualized medication, because that concept was embedded in Ayurveda. So we always say Purusham Viksha. Treat the person, not the disease. A medicine can have a varied effect on different person because the effect or action of the medicine depends upon many bodily factors. Now, Osler also says that he mentioned that science is uncertain. Science is uncertain. So we know that today, even after tremendous fast advancement in the medical field, okay, so still we say that medicine is he mentioned that the medical science is uncertain, because I cannot say that same medicine or same thing will happen. Suppose a bacteria come to one particular body, and how it will the body react may be different in a different body. So it cannot manifest same amount of the clinical manifestations, even the cure also. So this being the case, definitely medical science is uncertain. Okay, now that is also the limitation of the science. Why the reason is because each body is different. Therefore, what nowadays we are telling that host defense is important rather than the disease. So host defense is very important. Swasthasya swasarakshanam. Host defense is important. Okay, how the manifestations develop, it depends upon the host defense. When an infection takes place, how the body immune system react for that, depending on that, the number of manifestations will be there. Okay, so but medicine is a science which is very touching. What is the difference? Medicine is a science which is very touching because science is different. When I talk about medical science, it is very touching science because it involves the understanding, caring, reassuring, healing, in spite of all these limitations. Okay, so this is a limitation. But how the medical science is different from other sciences, here there is a part of touching part is also there. What is that? So we have to understand the problem of the patient, we have to care the patient, we have to reassure the patient, we have to heal the patient. So this actually comes under the part of the art. Okay, so this caring the patient, understanding the patient, reassuring the patient, healing the patient, this is not exactly the science, this is the art. Therefore, I am saying that medical science is an amalgamation of both science and as well as art. When both the things are there in a proportionate manner, then a doctor will going to succeed and patient will get benefited. Therefore, the debate is still on whether the medical science is a science or it is an art. The right answer is there should be combination of both. It is a combination of both. Now, coming to the next part, that is a holistic approach of Ayurveda. Ayurveda is known for its holistic approach because we always say we don't treat the disease, we always treat the Purusha. Okay, we know that physical body is nothing if you keep the mental faculty in a order, in a physiological state, everything will be corrected naturally. This is our version. So science has a limitation like medicine because there is too many variables. Many times patients are worried. Although the diagnosis and treatment is perfect, but outcome is not good. Now these are the common questions problems that we face in the medical field, in the practice. Isn't it? Many times we diagnose a disease. Many times we diagnose a disease. And after the diagnosis we are giving some medicines also. But still the outcome is not good. Patient is now worried. My diagnosis is over. Doctor knows the treatment, what should be given. He is giving the same treatment, but still I am not getting the anticipated results. Okay, patient is worried. Why this is happening? Why this is happening? Doctor is giving the same medicine which he used to give for all the patients. Used to give all the patient. But still in this particular patient is not giving the result. Again the problem is variability. Okay, probability, variability is there. Because it all depends upon how the host defends. Now how your body receives that medicine. The reason is again very simple. Each body reacts in a different way for the medicines. So therefore in some of the patients, the medicine may not be showing the anticipated results. Now sometimes what happens is no diagnosis was done and even doctor knows what is exactly the diagnosis. He gives some medicine but patient recovers. Patient recovers without diagnosing, without the absence of the clarity, even in the physicians, he blindly gives some of the medications. Okay, by having with a superficial idea, still the patient get a very good result. How you answer this problem again? Question again. Therefore, I am telling that medicine is a science of probability. Okay, Similarly, sometimes single medicine works differently in different patients. That also we will see. Yogaraj Gugulu or maybe Kanakasva or so many other medications which is mentioned in Ayurveda. So they work in a different way in a different person, and same is true with the contemporary medicines also. And even we know that many times simply placebo also works. Simply placebo will also going to work. So again, all these things proves that there are too many, what do you say, variability. Okay, so we also know about the vaccine. A lot of discussion is taking place on the vaccine. The vaccines also give a different types of results in different children, and we also know that during the COVID vaccine, what happened? Some of the citizens who received the COVID vaccine has got a lot of problem, and some may not had any problem. The reason is again, it all depends upon the body host immune system, body reaction, or we say host reaction. It all depends how host receives that medicine. Okay, so therefore thing is immunity is different in different person, so medicine will also work in a different way, and prakriti of the person is different in each and every patient, and as a result medicines also show the varied effects. So there are many factors apart from the medicines. What I mean to say is, when you are treating the patient, you are healing the disease of the patient. Apart from the medicines, there are so many other factors which are helping in curing the disease or removing the suffering of the patient. Okay, so therefore the art comes how you care the patient, how you talk to the patient, how you reassure the patient, how you show the empathy, sympathy, etc. So they are all work in curing the disease. It's not only the simple medicine. Okay, many times we come to know that LFT is normal. For example, I'm telling LFT is normal, liver function test is normal. Still, the patient has got loss of appetite or some other liver related problem. He has got some liver related problem or loss of appetite, etc., or weakness, etc. But still, if you, for example, I'm telling LFT is normal. Many times when LFT is abnormal, but still the patient has got good appetite. So we cannot correlate these things exactly. Okay, so then how we can say that science is absolutely a science? That means how we can say that medicine is absolutely a science? No, we cannot say it's an absolutely a science. So because it has got many other aspects to be considered. One of the main aspect to be considered is nothing but art. Okay, therefore medical practice is a combination of scientific evidences or science and as well as art. And therefore, what is exactly told in Ayurveda about the holistic approach in Ayurveda, that is dosha, beshaja, desha, kala, bala, sharira, ahara, satnasya, to prakriti, vaya, then avasthantarani. Okay, so these are the different factors which will going to work in healing a particular disease, or how the disease manifestation takes place. It depends upon the dosha, it depends upon beshaja, that is medicine. It depends upon the desha, it depends upon the kala, time factor, bala. So many disorders are self-limiting. Okay, so therefore these factors has to be considered, and therefore these factors are very well dealt in Ayurveda when they are dealing with the medicines or dealing with the treatment of the patient. Therefore Ayurveda is called as holistic medicine. Holistic medicines. In the next class we will continue the same about the holistic medicine. Thank you very much.